When you're sick or hurt to the point where you think you need to see a medical professional, where do you go? Well, if you're like a lot of Americans, you simply go to the hospital and wait in the emergency room and eventually get seen and treated. And that's absolutely an option. It's even the appropriate option if you're facing a true emergency situation. But if you choose to go to the ER for a rash or a cold or the flu or a stomach ache or a badly sprained ankle, you're not only spending more than you need to, you're likely making a decision that doesn't align with your values. Because if you're like me, one thing you value more than anything else is your time. Time to spend with your friends, time to be with your family, time to veg out on the couch. Whatever you want to do with that time, a trip to the ER eats into it. Most ERs treat patients in order of severity, not first come, first serve. So if you show up with a cold, you're going to wait. And who are you waiting with? Other people who are actually experiencing a medical emergency, the sickest of the sick, putting you at greater risk for getting sicker yourself. And of course, there's your wallet to think about. A visit to the emergency room averages $1,700. Some insurance providers won't even cover that if it's not what they consider an emergency. So that could be $1,700 out of your own pocket. Now, the ER has its place and serves a critical function in the healthcare delivery system. But you do have options, and I want to help you understand each option so you can decide when one might be right for you. Option 1 is your primary care physician, or PCP. If you're not in a hurry and your condition can wait for a time when your personal doctor is available, seeing your PCP can be a great option. The benefit of going to your PCP is that he or she sees you more regularly and knows your medical history. That familiarity may offer you a more personalized experience and treatment plan. The average cost for such a visit is around $180. If you don't have a PCP, I highly recommend finding one. Option 2, virtual visits. If you have a minor condition, like a rash or a sore throat or pink eye, and need to address it quickly, then a virtual visit might be a great solution for you. Most health plans offer you a virtual option. You go online, answer a few questions about your condition, perhaps upload some photos, and often within an hour, you have a treatment plan and, if appropriate, a prescription. No appointment necessary, and it usually costs less than $50. Option 3 is what's called a convenience care clinic. These are the ones you'll find in big box retailers or major pharmacies. They tend to be open longer than regular clinics, and they are staffed with nurse practitioners who are equipped to diagnose and treat a wide range of issues. They also offer flu shots and sports physicals. What's great is that you can walk in without an appointment and get in and out relatively quickly. And if you get a prescription, you can usually fill it in the same place. Convenience care clinics are great options for several conditions like allergies, infections, sore throats, fevers, and the like. And they usually cost less than $65 a visit. Option 4 is urgent care. When your condition needs immediate attention, but still doesn't rise to the level of an emergency, then the urgent care may be your best option. Urgent care clinics often offer extended hours and are freestanding or located in hospitals or other healthcare facilities. They are staffed by doctors, nurses, and nurse practitioners. They'll treat all the things the previous options will, but they can usually provide x-rays if you think you may have broken something or stitches if you have a bad cut. Like the previous options, you don't need appointments and wait times are generally not so bad. The average urgent care visit is $190. Your fifth option is the ER, and you should absolutely go to the ER if you are experiencing severe pain, especially in the chest or upper abdomen, if you're having trouble breathing, speaking, or walking, if you're experiencing severe dizziness, or if you have uncontrollable breathing, or if you experience severe trauma or serious injuries that you feel could threaten your life or result in long-term damage if not treated. But you should know that if it's not an emergency, you will wait much longer, and you will pay a lot more. What sounds better to you, $50 or $1,700? I think I know your answer. I can't tell you whether a situation is an emergency or not. Trust your instincts and do what you feel is best given the situation. But if you know it's not an emergency, then you now know going to the ER will cost you more money and time than is necessary, so choose wisely.